going to spend quite a bit of time on communication, and the community and mission are pretty self-explanatory. Again, missions are very unique to each individual person. This is a graph taken from a study. Apparently you can get a whole degree in how human health affects animal health. And this just is a study where they talked about people and all the different ways that their health can adversely affect animals. They're pretty straightforward and, pretty obvious, but you can break it down and put it into all these categories. But we're not really so much looking at that today. We're looking at our health. And because remember, our health is fundamental to our mission. You can't be effective if you're not taking care of yourself. So as we delve into health, we're going to look at this, disease. And I'd like you to look at this word, dis-ease. Remember we talked about well-being, being a state of ease? Well, when you don't have well-being, you have disease. And disease is a term we use readily for a lot of different things, and we're like, ooh, disease. Well, it creates a lot of disease in our lives. And we can't really talk about health without talking about our healthcare system. And I'm not going to go into this much, except to say this. There's two types of diseases that we deal with. We can break them down into acute illness and chronic disease. We're really pretty good at dealing with acute illness. These are things that are easily definable issues, quick cures, we know how to treat them. Chances are they're not going to come back. Things like a concussion, a car accident, gastroenteritis, even rabies, those are acute conditions because they have to be dealt with immediately. The other side are the chronic diseases, and this is where we all wind up, because most disease that we're exposed to is zoonotic. And they mentioned that word earlier in the talk, and I'm just going to tell you, zoonotic means a disease that can transfer from an animal to a person. And a lot of diseases do this. And being where we are in animal welfare, dealing with animals that are in bad situations, that are sick, that aren't getting their needs met, we have a focus and a concentration of sick animals, and then we have a whole bunch of those coming at us all the time. Guess what? We're high risk for getting diseases. It's a huge problem. So there's all kinds of ways we can get sick from animals, but the main thing I want to focus on today are these bad boys, vectors. Vectors, for our purposes, are things that suck your blood. Obviously there's snails here, and those don't suck your blood, but they're involved in toxoplasma, which is a cat-specific problem that we see, and they're really involved in concentrating these diseases into other species. I don't know how many of you have heard about the otter situation on the West Coast. We've lost tons of otters to toxoplasma, and it's because toxoplasma gets into the water, it floats, it gets into the kelp beds, these things eat it, and then the otters eat these things, and then they get this toxoplasma, and it causes all kinds of neurologic toxicity and high mortality. So we're aware of this, and we've started trying to address this, but it's a big problem. Today, we're talking about these two, fleas and ticks. We have to include ticks because they are probably the best biologically designed weapon that there is. Ticks and fleas have evolved long before we were on this planet to spread disease from one animal to another. And a lot of these organisms can't live outside of the host. So I'm going to talk specifically about fleas mostly, but we're going to look at the diseases that we can get from these ticks and fleas. And these are called vector-borne diseases. A vector, like I said, is something that sucks your blood. So mosquitoes, certain times of the year, mosquitoes are a huge deal, and we really don't think that much about them until something like West Nile virus pops up. But these are some of the symptoms that you see, some of the pictures you see if you look up these diseases. Bartonella in the upper right corner. This is an obligate intracellular parasite, meaning it can't live outside of the host. And that's the one we're talking about today, once we get into it. Typhus is another, it's a flea-borne disease. These are both flea-borne. Bartonella we think may be spread by ticks, but we're not quite sure yet. Those little lumps under the arms, the flea bites, all these lesions, you can spot this, you go, yeah, I don't have any of that. Well, I want to show you what Bartonella infection looks like. This is what it looks like. I have Bartonella. And surprisingly to you guys, most of us have Bartonella. They did a study at the University of North Carolina where they took all of the vets and 50% of them tested positive for Bartonella. Just the first time testing them. And Bartonella is not an easy thing to find. We wouldn't know anything about it if it weren't for one man whose father died of neurologic stuff, like Alzheimer type stuff, started falling over and then he died. That young man ended up finding out that his father had Bartonella in his brain, became a veterinarian, and spent his life figuring out Bartonella. And what we found out is this is a human pathogen that we weren't even thinking about, because we didn't know until AIDS hit that people had this in their system. A lot of these organisms are getting into our system and hiding and just waiting. They're waiting it out until our immune system breaks, till we get stressed, till somebody in our family dies and we can't cope, and then we break and we get sick. What do the symptoms look like? You pick your disease and it's probably related to Bartonella. Most of the infections that we get with Bartonella are asymptomatic, which means you don't know you have them, subclinical. They get into your system. And the way actually all bacteria, the way all bacteria work when they get into our system is they go to our bloodstream, because that's the free way to get all over our body. But they don't want to be there. The first thing they do as soon as they can is they grab hold of something and they build a biofilm around themselves to protect themselves. And this starts happening. So the more exposure you have, the more organisms you have in your body building up these biofilms. And where do we see it? Cardiovascular disease, eye issues, headaches. It can pretty much be anywhere in your body. And we haven't been looking at it or even talking about it. And we call it an emerging disease. It's not emerging, it's out there. We're just starting to figure it out. So if you've noticed, as you spend more and more time in animal welfare, you tend to get sicker and sicker. And if you look at your colleagues, they, end up quitting because they can't do it anymore. They're too sick or they die. It's the same thing in veterinary medicine. We have the highest the highest suicide rate in the U.S. of any profession. And we attribute this to compassion fatigue, and we have these organizations to help with that. But I believe that this is a lot more related to disease than it is to compassion fatigue. Or compassion fatigue is a symptom of this disease. And again, this is one of many. If you look at disease pathologies, if you Google it, it'll say things like Lyme disease, Bartonella, it'll say prognosis. If treated quickly, the prognosis is very good. But then they never tell you what happens if you don't treat it quickly. Well, guess what? You get chronic disease. So if you have issues and problems where you've been going to multiple doctors only to wind up at a pain management place or being told you need to see a counselor or a psychiatrist, you're probably dealing with chronic infectious disease. It's no fun. Okay, let me go on to the next slide here. This is just one of the reason why I focus on Bartonella is because my concern in animal welfare, I noticed that most people I can help. Most people want help, we can set up a dialogue, things go well. There's a small percentage of the people that we label as crazy or hoarders or whatever you want to call them that you just can't deal with. And those people wind up in the court system and then that doesn't go very well. I've never seen a court case go well for anybody. And usually it doesn't resolve the hoarding situation. The person just moves somewhere else and starts doing it again because nobody's dealt with why they're doing it. So I put this up because we're starting to link, well, first of all, when we first discovered Bartonella, there was one species. And when AIDS hit, we started realizing that this was in people. And since AIDS hit in the 80s, we've discovered 44 species of Bartonella, and they're unique to each one of these vectors. So each animal has their own type of Bartonella, and all of those can infect us. So this can be all over the place, and we don't really understand it too much yet. The next slide. Psychosis. Crazy cat lady. The person you can't deal with. The person that doesn't have rational responses. The person that you can't affect their behavior. This is a huge factor because I guarantee you when you see a situation like that with somebody that you're going to label as crazy, they are living in a home that's colonized by fleas. Or their mother was in a home that was colonized by fleas, or their mother was exposed. This thing transmits vertically from mother to children. So you think about all of our young girls going into animal rescue, exposing themselves, doing the worst possible jobs, contracting this, not even though they're having it, then having a child with all of these issues. So we're just starting to pull the lid off of this, and it looks like Pandora's box. So we need to be aware of it. Schizophrenia. I don't know if that one's in here. Neuropsychiatric. Unmanageable depression. Was that one in here? Well, anyway, there's a lot of problems with it. Okay, so I'm just going to talk about this briefly. Prevention. I want to say zero tolerance on fleas, but it's really hard to say that because even as a veterinarian where I'm out there preaching this, my son came to my house in California and said, "Mom, your cat has fleas." Like, "Yeah, I'm going to treat her." And then he went to my bed and took a paper towel and wet it and squeezed it out and laid it on the sheet where I was sleeping and showed me the flea poop, the little bloody dots on my bed where I'm sleeping. And that was a wake-up call, because here I am preaching this and it's happening to me. These are not things we can have zero tolerance on, but we have to be diligent all the time to try to get rid of them. Flea combs are your best friend. And if you come to our clinic, we'll give you one if you ask for it. So being very vigilant, making sure you establish quarantine with animals. Capstar. How many people use Capstar in their shelters? They come in, okay, Capstar is great. You don't have to use a whole pill. I might be violating some law by saying this, but it's all about saving money. You can take the large dog Capstar and grind them up. Well, we've got them under sedation, so it's a little easier. And sprinkle a little under their tongue, and that's enough. It's amazing how little of this stuff will kill all the fleas on them. But you don't have to use the whole pill. You can use the powder, and you can make it go further. We give it to everybody that's got fleas, because mainly we don't want our staff getting bitten. And also, we want to talk to these owners about it. Bravecto. What do you guys use that's better than Bravecto? Anybody? Yeah, there's nothing. This stuff lasts a minimum of 3 months, and I've seen it go up to 5 months. It's great product. It goes topical on the back of the neck. I love it. And then flea combs, check the environment. You've heard that 1,000 times ad nauseum, I'm sure. So testing, this is something that might be new. If you go to your doctor and say, "I just went to this thing about Bartonella and I think I might be exposed and I want to get tested," the doctor will sign it, you go get your blood drawn, and it'll come back negative. Because the standard tests out there are looking for antibodies. And this organism can suppress your antibody response, IgG and IgM. So you're not going to get an antibody response. The PCR test, often are negative, because this organism has to be amplified in the blood before they can get a positive. It's really hard to find it. It doesn't like to be in your blood. It likes to be anchored in your tissues. But this lab, GalaxyDX.com, is the lab that was started by that veterinarian that I mentioned. His name is Dr. Breischwitz. If you get a chance to go on YouTube and look him up, he's an amazing man. He has really pioneered this and pushed it and forced the medical field to deal with it too. Forced them to let him test humans and find that it really is a human pathogen and it really is prevalent in the animal welfare community. They have a website, that GalaxyDX.com is full of all kinds of resources for clients, and there's lots of resources out there for people that are dealing with chronic illness and chronic disease. I struggle with headaches. I've had a headache for the last 6 months, and I have a headache right now. I just manage it. These are not easy things to deal with, but there's a lot of ways you can address it and deal with it, and it's a lot better knowing what you have than being told you have something that's a syndrome. Most of us are diagnosed with syndromes. I'm just going to list off some: Parkinson's, fibromyalgia, restless leg syndrome. I'm trying to think of, I'm drawing blank, but most of the diseases that we get, cystic fibrosis, we've always called that a syndrome. Well, guess what? Now we're knowing that it's bacterial related. We're starting, this information is coming out, but there's a lot of resistance to it. As you can imagine, after COVID, our medical system is not so interested in discovering a new disease right now. They don't want a bunch of people out there with this disease that they have to treat. So there's not a lot of money going into this, but there are researchers, and it is moving forward. Okay. Treatment is difficult. Treatment is prolonged. I was doing really well, and then I got reinfected, and I'm struggling, and I haven't gotten back into treatment yet. So this is something that you have to chronically do throughout your life and be aware of the symptoms, know when it's coming on, and know when to get the medical help you need. And like I said, it can show up in many different ways, and neuropsychiatric is common. Depression, anxiety, all of those issues can be related to this. And it's not so much of whether or not you have it, because most of us are going to be positive if we've had exposure to animals, or our parent or our mother has. But it's what's your load and how are you managing it, and what else is going on in your body. So how do you find a doctor? Surprisingly enough, my experience, the worst doctor to talk to is the infectious disease doctor, who are supposed to be the experts, because they're like this. You need to go to a doctor that has dealt with people that have had diseases that the U.S. isn't dealing with, and that's mainly the doctors that came out of the Lyme epidemic. So these doctors realized that we were dealing with chronic infectious diseases that we weren't seeing on positive tests, and they started coming together and finding out new ways to test and new ways to treat. And there's an organization of them called ILADS, I-L-A-D-S, ILADS.org. And it's a medical organization for human doctors, but again, they have a ton of resources, and there's lots of affiliated groups for patients and people in animal welfare, and lots of information. This will rock your world if you really get into it and start looking at it, and it will change your health. Okay, so that's what we're dealing with that. Now the next part is the communication. I am so incredibly grateful that I got Lyme disease, because when I got Lyme disease, I got it at a week-long seminar, going to this with my kids, trying to figure out a better way to raise my kids and talk to them. We all got sick with Lyme disease, we all almost died, but in the end, this gave us the tools to deal with it. It gave us the tools to deal with each other, and it gave us the tools to reintegrate back into the world. So nonviolent communication is really the way we were intended to communicate. We have learned a different way to communicate that's based on conflict and violence, and that's really not what we want. So once you learn this, and you can start doing this and practicing it, you will work miracles with people. The most difficult clients are the ones you're going to have the most success with. You just have to stick to the principles, and that is, I can't read it, but basically it's just identifying when you're talking to somebody and they're screaming at you going, "I hate you, you just killed my cat," or whatever they're saying. Instead of hearing that and reacting to that, you're able to say, "Wow, that really triggers me. Okay, I'm going to take a deep breath." And then you're there with that person, you're saying, "I'm hearing that you're really upset and you're concerned that your cat's dead. Can I help you? What can I do for you?" "Yeah, that's exactly what's going on with me." Then they've said yes. So then you've got a positive, you've got a foot in the door, and you can start working with this person. And when you have these successes, it's really amazing, because you walk away feeling better and they walk away feeling better. Now, you're not going to solve their problems overnight, especially if they've got 50 cats in their house. But you keep working at it. And we can't help these animals until we help the people and change the way the people look at their pets, change the way they identify with them. But I have yet to meet a person that hates animals. Even the guy that comes and is like, I'd rather throw it in the river than bring it in here, but my wife made me. By the end of the clinic, they come back, and that's not what's going on with them anymore, because they didn't need that. That was like a thing they say. But then once they realize that you care, that they care, then they're like, "Fluffy, is he okay? He can sleep in my room tonight. I'll put him in my lazy boy." So these connections are what we're looking for. We're building on that. And when we don't get them, we can't manipulate, we can't change anybody, but when we get the connection, we have to take a moment to appreciate that and let the person know, "Wow, that makes me feel really grateful that you're willing to take this cat into your lazy boy. Thank you so much." Or whatever, something that connects with them, and where we feel this mutual contribution to each other. It's really, really critical to what we do. And obviously, remember, my goal here is to keep the animals out of your shelter. And I'm hoping that's part of your goal too. When you get these situations, really taking the time to kind of work through talking to these people, find out what's going on with them and what their limits are. This is a real quick introduction, and you're like, "Yeah, how do I do that?" It takes a while, and it takes practice. We did this already. I'm going forward. Sorry. Where's my tech guy? I think, am I at the end? I'm confused. I'm up here on my stage, I don't have any help, guys. Somebody help. This is 10 out of 20, but I don't know if I have 20, where are my other 10 slides? Okay, Tyler, come up here. I can't get to this next slide. Yeah, how do I get there? Okay. So, take a minute to look this guy up, Marshall Rosenberg. He's amazing. His story is amazing. He's done amazing work. Unfortunately, he's passed away, but his presence started a whole movement, and it's spreading, and it's going hand in hand with One Health. One Health is the idea that every problem we face has multiple components. The pet problem is not a pet problem. It's a people problem. It's an environment problem. We have to address all of these issues to get the success we want, and we have to work together. So one of the things we don't do are we don't make comparisons, we don't make demands, and we don't make judgments. Stepping back from judgments and just making observations. So if somebody, has 5 cats in their car and it smells like poop and, there's messes everywhere, you can say, I can see that you have a lot of stuff going on here. Are you struggling? Like, yeah, I'm struggling. But if you say, wow, your car's ready, no, it's not. So it's just a matter of saying something to them that's just observing exactly what's going on without passing any judgment, and not passing any judgment internally. Over time, your mind changes. The way you approach things changes, and you feel good because it gratifies us and it gratifies the other person. Okay? So it all comes back to what are you feeling? What's the person feeling? And this may sound silly, but what's alive in you? What's going on with you? And what would make your life more wonderful? Because really that's what we're after. We're trying to improve the quality of life for these people, and in return, the animals. Because they care about them in their own way as much as we do. We just have to remind them of that. So education's a big part of this too. And then the last thing is, this is the process that you're taught in nonviolent communication. It looks super simple. It sounds really simple. I get stuck on the feelings. I don't know what I'm feeling. It's really hard to break down your judgments and your past ways of dealing with it to get this. But when we talk to somebody, we're not trying to get them to surrender their animal. We're trying to figure out what's going on with them, establish a connection, and help see where they're at. It's called empathy. I don't know why empathy's gotten a bad name recently, but it's the best tool we have in animal welfare. So we start with observations. I observe that you have a lot of animals in your home and you look like you're needing some help. Can I help you? Wow, this is really making me feel very stressed. I can't imagine what it's like for you. What would create more ease for you? You have 50. How many do you want? That's a question that I always ask. How many animals do you want? And most people can't say it because they're afraid you're going to kill the rest of them. So you have to get back to how many do you want? We'll deal with the rest of them. We'll figure out ways to deal with them. But let's figure out what's good for you. And what you find is these hoarding situations are your best advocates in the community. If you can help one hoarder get their life under control and get to where they have 3 cats or whatever they need, and then you say to them, okay, now, don't take another one on. Next time you see another situation, bring them to us. We'll help them. Then they're going to go out and find other hoarders to bring and help them, rather than going and taking that hoarder's animals. So it's the idea of building up our armies or our base of people to help in the communities, and also education. And then requests, needs and requests. You can offer help and you can make requests of the people, but if they say no, you have to understand everybody always exists in choice. That's why punitive stuff doesn't work, because they have to get choice. So what we have to do is work with their choices and try to help them come up with new strategies so they can make better choices. Okay? And then what's this one? Observation, evaluation. So here's an example. An evaluation, but you're so lazy you never do the dishes. An observation is, the dishes have been in the sink since last night. I'm wondering if you would be willing to wash them. She's always rude in the meeting. She interrupted me twice during the meeting. This is a very specific statement that's just saying exactly what happened. But this one is judging her. So there are very slight shifts. And this one, the observation, comes a different way of thinking. You're not mad at her because she's rude. You just notice that she interrupted you and it created frustration in you because you really wanted to communicate this to whatever. Now you can go down these paths and really communicate and talk about what's actually happening. It takes lots of practice. And this is, when you get into it, you know, I said I couldn't figure out what I was feeling. Well, this is how complicated our feelings are. This is a feelings wheel. And most of us are stuck right here. And we can't get into these deeper feelings because we just don't spend enough time thinking about what we're needing. But doing that and being really clear on what you need and what you want, you have to have before you go after your mission. Okay. And this is another part of the process. And then once you have feelings, then those lead to needs. Okay. I'm feeling frustrated because I need calmness or something. That's pretty much it. This is really, really, really important, and this is what we spend most of our time talking with our staff about. When they come in, that woman was just rude to me, and we have to let's step back. Let's try this from an NBC approach. Try calling them up and let's see if we can get a better result. Always making requests, never making demands, and never judging anybody for making a choice that they make. So if they say, no, I don't want to surrender my 10 puppies. I'd rather them die than give them away. That's a hard one. That triggers me. But, getting triggered doesn't help. Remember, my goal is to help this person and help this animal and help this situation. So I go, wow, that makes me really sad. Or I feel really sad when I hear you say that. I'm wondering if there's, and then you come back at them another way. And the idea is just to keep them engaged and to try to build some kind of a connection with everybody, even the worst clients. Because remember, worst is a judgment. Okay, anything else? Is that it? Thank you so much. And then, those of you like me who tried to think you could just solve this whole problem on your own or go clean up a trailer court by yourself, you can't. It's temporary. We all want our work to matter and to last, and we can't do that individually. Even if you clean up every animal in your town, the minute you're gone, it's going to start all over again, unless we start putting systems in place to educate kids in school, to work with people in the community, to get these people that are in crisis into situations where they're not judged and can get help. We have to all work together to do this. So that's our goal. That's what we're here to do. We're here to help you and support you. If you have any health issues at all, I've been there myself and with a lot of other people, and I can help you and I can guide you to find resources you need, because ultimately your health is dependent upon you. Your doctors are just there to advise you. So you have to remember to take the reins into your hand. Now, what I want to know, did we do any survey or anything? Okay. Yeah, long-term versus short-term success. Okay, last one. This is what I want to know. Did this talk today have any impact on that mission statement that you thought of this morning? If you can just scan that and let me know. Did it change your mission statement at all? Because NBC totally transformed my mission, completely. And gave me a lot more success. And people don't hate me as much. They still hate me, but they don't hate me as much. How long do we give them? A little bit? No? Okay. Okay. All right. Okay, well, almost half. I'm happy with that. It takes a while. And the first time I started this process in 2012, and I'm still just a beginner. It's not easy, but I'm convinced that this is where our future lies. One health, connectedness, and non-judgment. Helping each other, because we all understand what it's like to get in over our heads, and we all understand what it's like when your thinking isn't quite straight. Somebody needs to help you get back on a path where, it really is hard to deal with 35 bottle babies at once. I did that. I tried to take, when I first started spay-neuter, I didn't believe in aborting kittens. So I came home from a clinic from Indianapolis. I don't think any ferals still around or here, but I came home from a feral cat clinic with 35 belly babies that I pulled out of a belly. And I was trying to nurse them all night and go to a clinic the next day. So, these are the kind of judgments that we make that clearly from the outside look ridiculous, but we're going through them, and we as people that understand that need to be able to reach out to them, to the people that are in distress. Okay? And put up with their stupidity, because we were all there once. All right. Any questions or anything? I think the questions are later. Yes?
Am I done?